You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey everyone, how you doing? I'm Dr. Megan Kelly and this is the Veterinary Rehabilitation Podcast. I've got Angela Griffiths from Griffiths Veterinary Rehabilitation and Referrals in the UK. And we're going to be chatting about a really interesting topic. We're going to be chatting about amputees. She has a lot of experience because she has actually had her own animals that are amputees, and she's currently got one, and she's had ones in the past. And then obviously also she does a lot of hydrotherapy, and she treats these kind of cases, whether it be underwater treadmill or pool. And so we're really going to dive deep into sort of the different types of amputees that we get, and just how this affects our treatment, when we're doing hydrotherapy with them. So welcome, Angela. Thanks so much for joining me.
Hi, Megan.
So like I said, you've had some personal experience with this. Tell us about your own pets that you've had that have been amputees.
First pet I had that was an amputee was actually a cat. So when he was about 1 year old, he fractured his leg badly. And they thought he just caught his limb in something and fractured. And then when they looked more closely, they found that he had osteosarcoma. So he had an amputation. So my husband at the time was distraught about this, and I just saw it, this is before I worked in rehab, as okay, we've got to do a rehab job on him. And what was interesting with the cat was how long it took him to adjust to having that limb not there. It was a forelimb. He was lucky he didn't get any further spread of cancer, but he had to learn to stop because the forelimbs are stopping. So he'd jump off a chair and nosedive or run too fast and then not quite stop before the wall and things like that. So it was probably about a month for him to make those adjustments, but he was a young cat and it was easy for him. The second dog I had was, since I've been running a rehab centre, and that was a rescue from Battersea Dogs Home in London. And what happened with him is he had a badly fractured radius and ulna. The vet put the limb in a cast, and the owners didn't take the dog back to have the cast removed. And so what happened was really severe infection, but also the lower limb rotated round, so awful. And the tragedy was that dog could have been treated for free if they'd taken it back to Battersea, so where they'd rehomed from. So he had amputation, was rehab, and just like many dogs that come to us, never left and was rehomed with me. So he was called Kane, lovely greyhound, but he was a large greyhound, very heavy, but with that limb missing, the adjustments he made were so good that he would run up to people, say hello, and they would sort of say, has he got a toe missing or is something wrong? Because they'd just seen him running around the field looking like a deer and not realised the whole limb was missing. So he rehabbed really well. So he was about 5 or 6 when I got him. And then currently I have Poppy, who's a 3-year-old shepherd that I had, I rehomed as a puppy, and she's got a little right forelimb. So mine are all forelimb amputees, but so she isn't a true amputee, but her gait is that of an amputee a lot of the time, where she doesn't use her right fore. She uses it more as a hand, but then she does bring it into use when she's running. So I suppose we can talk about full amputees, and then we can talk about dogs with limb abnormalities that approach a dog being a tripod as well. So yeah, it's interesting living with a dog, say if we go back to the greyhound, where even though the limb was missing, he would still go to dig up his bed and use the stump as though he had the full limb there to dig up, which obviously ends in folding up into the bed and whatever. But you see the problems they have, and with all of these dogs, the big concern is any injury or any problem with the contralateral limb. And that's always where my focus is. Even if they're a new amputee or an older amputee, you're always worrying about, it's disastrous if we have, if it's a hind limb amputee, we have cruciate failure, or if it's a forelimb amputee, because they take so much weight through the remaining forelimb, that they're then taking full 60% weight through that forelimb. They will weight shift back a bit, but you sort of elbow and carpal joints are under extreme stress, and quite often the lateral ligaments to the carpal joint become stretched and start to collapse, and you need to support them. So it's a kind of a whole dog or whole cat management problem.
Yeah, I mean, obviously the ones that have hind limb amputations do a whole lot better than the ones that have forelimb amputations because of that weight distribution, 60% in the front and 40% behind. But it's so interesting when you talk about the greyhound, because I also think that depending on the dog's personality and the breed, some of them do better than others, don't they? So, you know, we have so many different types of breeds, and some of them just get on with it, like the greyhound. Like, nothing's stopping me. I'm just, this is not going to hold me.
I'm just running it.
Yes, whereas others will just be like, oh, this is so bad, you know. And it's the same in people. Obviously, you have such different personalities, and how people deal with these type of adversities, the same with pets.
I think really though, vets can be very negative about forelimb amputation and sort of set the client up for this is really difficult because it's a forelimb amputation. And obviously if you've got severe elbow arthritis in the contralateral limb already, then that's a much more serious decision to be taken. But I think there's a lack of support really for people that have animals that have to have amputation, and often it can be quite a positive thing if the animal is in pain and really struggling, and that limb is really making their life awful. The same as people will decide to have an amputation rather than go on with trying to rehab and continuing pain. So I think often the dogs that don't do so well are because the clients may have a negative attitude and everyone feels quite sad about it. So part of my job is really supporting those people and saying, look, your dog doesn't know how it looks. It hasn't got any of those disability issues that you have with people. It doesn't have to worry about earning a living and paying the mortgage and all of these other things. It just wants to be a dog and get on with life. And what we have to do is make sure they're supported and they're pain-free for however long they're going to be with us.
And then obviously when we look at these amputees, like you mentioned, whether they have a stump or they don't. So traditionally vets were always told to amputate as high as possible, but nowadays you see them actually amputating lower down. And with the use of prosthetics and advancements in prosthetics and orthotics, if we've got enough leg, obviously we can have a prosthetic. Here in South Africa, we often get people that will come to us and, you know, the dog's had a paw issue and they've had to amputate. And because we're told as vets to amputate as high as possible, then they amputate. And then once they're amputated, then they start looking for the prosthetic, which as soon as you don't have enough bone to anchor the prosthetic on, you can't do anything about it. So obviously the stump is also an issue. You know, like your dog that you've got now, obviously, you know, it doesn't have a paw. Is that correct?
She has, so her digits are all missing, and she's basically got the bigger pad. So, but the limb is short, the radius and ulna are shorter. So basically she's got a little stump with, luckily, a pad on it, and she uses it to balance, she uses it to hold her bowl or open doors inwards and outwards, all of those things. She'll use it as a hand because she doesn't need to stand on it. She's got her other limb to do that. But that shortened limb, we did actually try to have an orthotic for her, but the problem was that she would just slip her paw down and slip her paw out. And often you find when you do try to use either prosthetics or orthotics, that they can be quite disabling for the dog, and that it's the human, you know, this would be a bit controversial what I'm going to be saying, I think, but it's the human trying to make the dog look like a dog with four legs. And rather than thinking, actually, how is this, you know, it's got to be really good and work really well to not be disabling the animal. And often, especially with younger dogs, just not having that limb in the way and not having to deal with the, you know, stump care is a big deal for humans as well that are amputees, not having to deal with that. If the animal is strong enough and fit enough and the other limb's okay, actually, I think very often they are better with a full amputation. Their quality of life is better, rather than us putting them through surgery, months of pain, then failure. You know, quite often you get infection, don't you, post-op infection, osteomyelitis, all of these, you know, rejection problems. And we have to say, you know, if this is perhaps is an osteosarcoma reason for amputation, the quality of life and the length of life versus how long are they going to be recovering from those surgeries. They're really difficult decisions for people to make. And I feel just because we can do it doesn't mean we should do it. Like, ethically, we need to look at it from the dog's point of view.
Yeah, I think, when we're chatting about prosthetics, I think a few things come to mind for me. A younger dog that has more years to live with only 3 legs. And if there is somebody who knows what they're doing with prosthetics, and luckily now we have loads of people in all different countries that are actually able to make prosthetics. If I've seen dogs that I've treated and I've made prosthetics for, without the prosthetic, the worry is obviously the change in biomechanics.
Yeah.
And as you mentioned, the stress on the other joints. So you end up getting problems with, neck problems, back problems, contralateral limbs, and obviously also the risk, for example, in a hind limb, you always have that risk of a cruciate going on the other side or something like that. So, I mean, in my practice, when I've been treating these kind of patients, if there is an ability to do a prosthetic, personally, I've always gone for it.
Have you?
As the finance to be able to do it. But saying that, I have had one that didn't work, and the dog just didn't like the prosthetic. Everything that we did, there was no rubbing, there were no marks, it just didn't like it. It actually was holding it up, and we tried a number of different things. So I think that personality thing just comes down to it. The ones that have worked have been amazing. And, I think about, the treatments that I had to do for compensatory pain. As soon as we got the prosthetic and it was working and functioning well, there was so much decreased compensatory pain, especially in the back. You've got a lot of tension in the back because of them compensating and shifting their weight. But you have to have somebody that is able to do prosthetics and to do them well. I think,
and that post-op care and support has to be there. And obviously, you'll have had a good experience because you were doing the rehab. So you've done that support through, haven't you? And ensured, everything's in place to get the best possible result from that surgery.
Yeah. And what about the stump? If we're looking at, I'm just thinking now of the dog swimming or in the underwater treadmill, that obviously also affects it, because there's, if there's a stump that they're not actually be able to put weight on, there's resistance when they're in the water. And especially like if I think about, it depends on the reason that there's been an amputation. So have they got feeling there? How much movement have they got there? So the cases that I'm particularly thinking about are like your brachial plexus avulsions, where you've amputated, and those ones generally sometimes they have some feeling, and maybe we try and see whether we can get some movements, and we've got to make sure that they actually can feel and actually move, because otherwise it's just a dead leg that they're dragging around, and worse so when they're in the water.
Yeah, absolutely. And one of the things I warn my students about is when they have these suspected brachial plexus avulsion dogs, that you will have them in the water and there will appear to be limb movement. They get very excited, tell the client, look, they're moving the leg, and actually all the movement's coming from the shoulder, none of it's from the lower limb. So you very much want to be hands-on and feeling, is that actual real movement? So we always sort of say, just don't say you've got movement unless you're actually 100% sure, because you're giving false hope. I very, very strongly don't like putting amputees in a water treadmill. It's so difficult for them. Even if we just think about the treadmill movement takes away the standing limb. Why would you want to do that? You're going to have to be supporting that dog fully. The whole point of water treadmill is to get good gait. You are not going to be getting good gait in the water treadmill with an amputee. You're going to be getting gait, and you're forcing the dog to do it. They have to bring that limb through. It's very difficult for them. I much prefer having these dogs in the hydrotherapy pool. You know, we've done pain management, we've done massage, we're doing physio, we're doing our land work, but I want them actually physically strong and fit and dynamically strong, and that really leads us to go to the water, to the hydrotherapy pool. I absolutely hate seeing videos of people struggling to do water treadmill treatment with amputees. I just don't think it's the right thing to do. The dog has no choice. It can't stop if it wants to. In the pool, it can just float in your arms and say, no, I've had enough. In the water treadmill, it's like a hamster on the wheel. They've got no choice. So I really absolutely hate seeing it. None of my physios will do that, and none of them will ever say that that's a good option.
Yeah, I'm in agreement with you. If you look at them, you know, you also, I think in the underwater treadmill, you're not able to stabilize them, and they're not able to stabilize themselves. It's just this jolt, you know, as they're moving forward. And, you know, in the pool, you're obviously able to do things in order to support them. So let's chat about that a little bit. Like, how would you stabilize them? Because obviously without that one limb, like for example, on the front, they'd be going down on that side because they don't have that leg to be able to push themselves up. So how would you stabilize them if it was a four-limb amputation?
Okay, so very often with the forelimb missing, we'll quite often add extra flotation on the side where the forelimb has been amputated, because as they dip over, so say it's a right fore, you would use, if you started to tip to the right, you'd use your right fore, do a couple of strokes and bring yourself upright, and the limb's missing, they can't do it. So we'll add extra flotation on that side. Some dogs don't need it, but what will absolutely 100% be is side by side with them and hands on and supporting, so that there's no possibility of them rolling over. And that's especially in the case of very heavy set dogs, and also very deep chested dogs like greyhounds, Great Danes, Dobermans, those kind of dogs that you know, are quite prone to tipping over anyway. It's not so bad with the hind limb, but again, you do find that they'll dip one way or the other and they can't right themselves. So we'll be hands-on with our hands sort of basically over greater trochanter. So you'll still have someone on the front supporting with them. You don't want to be 2 foot away or a meter away and the dog starts to tip. You must be there. So it's pretty well always at the beginning a 2-person swim. And actually, you can get away with one person with a forelimb amputee because that's where you're standing, that's where you're supporting, holding the jacket, holding the dog. Whereas with a hind limb, you can't be doing that and the back as well. So actually, weirdly, it pushes you more to 2 people, 2 hydrotherapists with a hind limb in my experience. I think the whole benefit about the dog being in the hydro pool is if you look at the research done by Sarah Shannon, I know she's recently done a lecture on the biomechanics of swimming, that the dog's gait in the pool is so similar to their gait on land when they're running, that's what we want to strengthen and that's what we want to improve. So you're getting the cardiovascular benefits as well, anti-inflammatory benefits, all of those, increased balance, proprioception benefits you're getting too, but you're really, that's the big difference between the pool and the water treadmill, is that in the pool you're reinforcing the good gait and strengthening them in all the ways that they're going to need to move on land, whereas in the water treadmill you're actually just reinforcing, like you say, they bring the limb through and land very heavily. You're reinforcing their gait problems and not strengthening them in the way that we want to strengthen them. We're actually reinforcing their gait abnormality because it's so difficult to correct for them in the water treadmill.
Now, you and I have had a conversation before about whether we have life jackets or not in hydrotherapy. And this is obviously one of those cases where you will have a life jacket. And you know, we about that buoyancy, you add that to the life jacket, don't you? So you're adding it on like
yes. But you could, with some dogs that are good, you know, there's always a thing where, has the dog swum before? Was it a really good swimmer before? And then you might have a harness on because they're actually comfortable with that. You can still give the support. So when I'm talking about adding flotation, I'm talking about adding it at about shoulder level where the limb is missing, because you've lost that buoyancy of that leg as well, if you see what I mean, because that wants to come up as well in normal circumstances. So the flotation would go at shoulder point. There's lots of other clever things you can do with noodles, and you know, you've got to get your flotation right for that dog, and that may or may not be a harness or jacket, though in effect I pretty well always find we need a jacket. But we're really fit dogs, young dogs like labs, they can swim pretty well. We just have a harness because it gives us something to hold the dog by. I don't want to use the collar. So it's not a hard and fast rule with these dogs, but certainly if they're a new amputee, absolutely they're going to have a jacket on. They might have 2 jackets, they might have 2, even 3 hydrotherapists with them when they're starting. But you're looking to get to a dog that can do a half-hour swim really well, really strongly. And it's great. I actually think mentally it's great for the dog, because you're normalizing movement in the pool and they get carry over pretty well, but you're also showing the client that the dog can have fun again, you know, and that rewires their head. If they're more cheerful, they're happier, they're more positive about the dog, that comes through to the dog as well. It's the highlight of their week very often.
No, I'm in total agreement. You know, you can see dogs that even, I mean, you see it even, not even with amputees, just dogs that have poor mobility and not able to do what they used to. So definitely the amputees, you can just see how much they love it. Let's chat a little bit about the causes, you know, why we would actually amputate. And one of the things that comes to mind is an osteosarcoma or cancer. And how does it affect your treatment if these dogs are presently having chemo?
So it depends on the chemo they're having. There's so many different types now, and how sort of cytotoxic the medication is being used. So some of the dogs are on a daily tablet and not very cytotoxic, so you can actually handle them safely. Again, a bigger hydro pool is better because you've got a bigger water volume, more dilution, all of those kind of things. But I've had situations, I always get in writing from the vet who's giving the chemo treatment, what are the health and safety risks for my staff? And I've actually been told there is no risk whatsoever for your staff, but I wouldn't actually have any of your staff that are of childbearing age in the water. And it's like, you've just told me it's totally safe, but all my staff other than me are of childbearing age, you know. So pretty well what happens if they're having the monthly chemo is they will have their chemo treatment. We have to wait a week, then we can fit in a couple of hydro sessions, then they go for treatment again. So we work their sessions around their chemo treatment, but we take a lot of advice from the oncology vet who's giving that treatment so that we know that it's safe. The other thing is sometimes dogs can be a bit unwell post-treatment. Certainly for that first week they can be a bit off colour, not as badly as humans are with chemo because the doses are much lower for dogs, but we want to take into account, are they actually well and are they fit enough to come to hydro? So we just juggle around, and it's a bit frustrating because you'd rather be swimming twice a week or once a week regularly, but you're just going to have to live with that schedule.
Obviously, when you're now seeing these cases, you have 2 different types of cases. So sometimes you see those cases that have just been amputated, and then you're able to help them from the very beginning, which is obviously better because you're able to then give them advice about the changes in biomechanics and the effects on other limbs, and especially that contralateral side. But sometimes you must also get those cases that have been amputated and the owner just thinks, oh, well, they're doing fine. Yeah. And then as they go by, as they start getting older and older and older, they start to get lower and lower and lower, and all the compensatory issues happen. So obviously those 2 types of cases are very different in how you approach them.
Yeah, I mean, with the first case, what you're trying to do is get back to full fitness, and you're dealing with any of the secondary issues with pain, as you say, in back, neck, whatever. But you can be pretty positive about working with those dogs. With the other ones, they're usually referred and they'll usually come in, our physio will see them first and we'll address any of their pain issues before we even think about hydro. The hydro will be much more gentle, much more focused on perhaps massage, the benefits of warm water, floating around, you know, more like a spa treatment. And gradually we might be able to move to strengthening. But initially what we're dealing with is those, you know, the same as you would with a chronic DJD or OA dog, you're dealing with really those older dog issues, and it's supportive care really, isn't it? So I think pain really is the thing that would concern me with those most. but then and you're treating them like an OA dog. But the other things you need to consider with those are, you know, has the time come where the dog now needs a harness, a hind quarter or front end harness, specially adapted for them to give support, and we need to kind of educate the owner when they should be given that support and help. It's also when we start to use orthotics to support perhaps carpal joint, something like that, or tarsal joint, where you're starting to get collapse of those soft tissues because they just can't do it anymore. Sometimes weight is an issue as well. It's something we have to deal with. So you're looking at the whole picture. There's no point in just doing hydro if we don't look at the fact that as soon as they go back on land, their hock's collapsing or their carpus is collapsing. So all of that has to be taken into account. So there's client education and support needed there.
So you mentioned those harnesses. I think this is a great topic just to expand on, because, you know, a lot of them, you know, rely on the legs to be able to anchor them. So one of the problems is off the shelf type of harnesses, although they're sort of proper rehab harnesses that you're able to lift and help the dog, as soon as you put them on an amputee, they just rotate and pull around.
Yeah.
So we often actually need to get some type of custom made harness, especially for amputees. Do you have someone locally there in the UK that you refer to? How do you manage these type of cases?
There's some harnesses called Katak that we use that it depends if the dog's got a stump or not as well. So if there's no stump, if the shoulder blade's been taken, then actually what we want to do is fill in that hole. So sometimes I just get a seamstress or someone to do that for us. People that do work with saddle making and whatever are very good at that as well. If there's a stump, then what I'll do is kind of make a mock-up with some material. I'm really bad. Sewing and knitting, strangely, are not any of my skills, but what I'll do is make a mock-up, take the measurements, and we can actually send off and they will make us a harness to fit. So they'll take a standard harness, and then again where the limb's missing, they will add a sort of pouch so that the limb fits into it, because you've got to be really careful that you're not irritating the skin around that stump as well where the harness is moving and slipping. So you can get it done. You can either get someone you know to do it, or some of the harness suppliers will make those to fit for you. I think the important thing with the harnesses is to make sure that they're very supportive, very wide. They're made of good enough material that's soft enough on the inside that you don't get rubbing and wounds, but strong enough that they maintain their shape so that they don't narrow, and then you end up with a very thin sort of strap which then cuts in and is quite uncomfortable for the dog. I'm thinking back to a client we had, her Rottweiler, who was huge, had a forelimb amputation because of osteosarcoma, and she was really, really struggling to walk him and help him. So came here. She actually wanted a front end cart measure up, and we said actually the cart is going to disable your dog more. And what we did was did a mock-up of a front end harness, and I had film of her with the amputee Rottweiler and her other two Rottweilers. Within the first session, they were running round in our rehab field, and the smile on her faces and the joy with the other dogs was just great. And because what she could do was just, as that dog landed on the remaining forelimb, just soften that landing, because they land so hard. And what I've seen with a few dogs is then neck issues, cervical issues because of that impact. So, and she only needed that harness for about a month with that dog while they made their adjustments. And I think they should be discharged from hospital with some support. You can't expect the dog to make that adjustment and go onto that contralateral limb straight away. It's too much for many of them. So sometimes the simplest thing is a harness to support and then strengthening with hydro.
Yeah, you're chatting about the stump. You know, often that tissue that is on the stump is where the scar is, and there's usually no hair to protect it, and it's that very thin type of skin, like scar type of tissue. Yeah. And so the worry is if you just, you know, you were mentioning about just covering up that where the hole is, you have to use tissue that has a bit of stretch, because if it's too hard, what actually happens is the stump, depending on how the stump is, if it's quite protruding, it actually becomes a focal point where there's pressure from the harness.
And pressure sore. And the harnesses I like and the ones I found work best are made out of neoprene.
Yes.
So, and there's some in the UK, they're called walkabout harnesses, but that neoprene seems to be the thing that works really well with us. But you could actually also line another harness with neoprene. And I think you need to be careful how you make that pocket for the stump as well. Make sure you haven't got, as you say, any seams on the inside that are going across that stump area or that scar tissue area. So seams should be on the outside, and preferably no seams anywhere near any of that sensitive tissue.
Yeah, and you want the area where there's going to be support to be over the largest surface area that you can. So never
so like the chest or pelvis, really.
Yeah, so it is tricky, and also it's not easy just to make an amputee, front amputee and hind limb amputee harness just in general, because like you say, the stump is always different. It depends on what's left, the shape of it, how pointy it is. So there are lots of things to consider. You were chatting about wheels. So I've had a few cases before, that sort of towards the end of sort of time in their life when they've been an amputee and we start to get major compensatory issues, where I've actually got a front wheel cart for them. And, they don't use it all the time, but the owners have used it actually when they're going for walks so that they can still walk with the older dogs to decrease that load on the contralateral limb. And I must say it's worked really, really well. For these kind of cases, I do find that custom-made carts are the best. So the sort of adjustable carts that we get, which are great for short-term, I find, but I find they're a lot heavier and they don't often fit as well. Whether it's a hind limb or a forelimb. Have you used carts in any of your dogs that you have, and for any of your cases, and seen them actually use them well?
I haven't used them with any of my dogs because I haven't needed to, but with clients' dogs I have, and with good success. And as you say, importantly, they wouldn't be using the cart all the time. It's just to go for a bit longer walk. It takes pressure off the limb that, where you've got, as I say, sort of ligament damage and joint damage. And yes, it's worked really well, and it's given the dog a quality of life. They don't have to be left at home. They can go with the other dogs. But as you say, it's got to be a custom-made cart, and it's got to be fitted by someone who knows what they're doing. With, like the harnesses, they need to be custom-made and they need to fit, and you need two, really, one in the wash, one not. And with the cart, it's got to be good quality and custom made. Cheap alternatives just don't work for these dogs. And if it is, we work with Eddie's Wheels in the USA, and I just find their carts are so well engineered. There's so much help and backup if we have a problem. And the really important thing about those carts is their quality that they're made with, and how light they are, and the engineering that goes behind it. And they understand the dog's biomechanics, and feed in and help you with that. And unfortunately, you're now getting people buying carts from Amazon or eBay or whatever, and they turn up to us because they realize it's not quite right and say, can you make this cart work? And it's, it's really difficult, because what I'm having to say is actually get it back, get a refund, and put the money towards something better. But obviously finance is a huge issue for people, and lack of education about this, even with vets and people who aren't involved in rehab, is a real problem. So often the advice is either wrong or poor.
I really like Eddie's Wheels, especially for custom carts. And I think that, when people think about carts, they just think it's 4 wheels and a frame, and it really isn't. There is so much to go into balancing carts. I do think there's a place for adjustable carts, and I do think there's a place for the custom-made ones. But we had a dog that had a deformed front leg, and then needed to have 3 ops on the other front leg. And we actually got a front limb cart from Eddie's Wheels. And as you say, they're so light and they're just so well made. For those of you that are thinking, if you've got cases like this, often we sort of just look to people that are close by. But you can use people in other countries if they've got really great products. With Eddie's, they have a whole sort of form that you have to fill in, and all these different measurements. And I have imported a number of carts from them for dogs that are going to have long-term carts, because they are so light and just so much better for these kind of cases. And I've never ever had to adjust the carts. Every single time I've done the measurements, they bought the cart and it's been perfect. I don't know what you found, if you've had to make adjustments, but it's not complicated. So for those,
it's not complicated. It's what I do. It's one of the things that I do. Sometimes I'll have to tweak the cart a little bit, but that will be down to my measurements or difficulty of measuring the dog. And sometimes what we do is set the cart a bit higher so there's less weight through the limb. And then as they strengthen, we can increase that weight bearing. So we very much use carts as part of our rehab toolbox, I suppose. So we use carts for lots of different reasons. I think the important thing when you're choosing a cart is the saddle, if it's a hind limb, or that support harness or structure at the front. I don't know, the patient you mentioned, Megan, was it a two-wheel or a four-wheel cart you had for that patient?
No, it was a two-wheel cart. So her hind limbs were completely strong enough. She just started obviously collapsing in the front, so we needed to get her up. But you know, it is very good with all those kind. When you tell them everything, they made it so that it had a support for her. So there was a complete support for that side where her one little leg was up like this, you know. So they made it. We took loads of photos from different angles.
And that's the important thing. If you give them enough information, you know, they'll come back and say, I don't agree with you. My computer model says measurement D and C cannot be right. Like they know if you've got something wrong pretty well, or I have to say, actually, this dog is really weird and doesn't fit the norm, you know. So I like the support you get from them and that backup, and they want to get it right for you. I actually visited them in New England, spent 3 days with them year before last. It was fascinating seeing the care that they put into building those, and the spirit, really, the team spirit within that organisation, and that runs right through from Leslie and Eddie all the way through to their staff. So that was a really big learning opportunity there. I went with Sal Pimlott, one of the vets that I work with and lecture with. So we had a great time. We were in you know, rehab heaven because we both like our mechanical stuff, but we just learned so much to bring back to our patients as well.
Yeah, I think, you know, just chatting about this now, I think one of the trainings that we got to look at, and maybe this is something for the Online Pet Health membership, is to actually look at balancing carts. So just some tips on what a balanced cart looks like and what an unbalanced cart looks like. And you know, there's so many things. For example, if the dog's able to use their legs, the placement of the wheels, where the wheels are, and where the harness is, and where the pressure points are. So that's definitely something that we can look at. Angela, thank you so much. It's always so awesome to chat to you. Did you have something you wanted to add? Sorry.
I was just going to say that the quad carts are really, really difficult to get right. And I struggle sometimes. I have to send them films and say, look, I've done everything, and it's difficult. So even with sort of 15 years experience, you still need that backup. But I think this whole amputee area is somewhere we should be informed about, and we should be able to give back up to the clients. So I really enjoyed having a chance to talk about I'll put some film up of Poppy, my little girl, on a Hydro webinar as well, I think. So or Online Pet Health. I'll send you some film. You can see her gait adaptations and naughtiness associated with.
Awesome, would love that. Angela, thanks so much. Have a wonderful day. Thanks so much for joining me as always. And looking forward to our next conversation. We always have interesting ones.
All right, bye. Bye.
Cheers. Vet Rehabbers, thanks for listening to my podcast. Don't forget to click the subscribe button, and it would be great if you could leave me a review. I want to know, what are you doing on the 15th to the 17th of November? It is our Vet Rehab Summit, which is our online virtual conference for veterinary rehab professionals. Find out more information at onlinepethealth.com.